Thank you, Leader. A follow-up on a question that was asked before. We talk about how these subsidies are needed to keep premiums low, and I think there is a question in a lot of people's minds that if these subsidies are truly needed to keep those premiums at that level, does that signal that there are reforms needed to the ACA to lower premiums in general?
It's incredibly important to make sure that we extend the Affordable Care Act tax credits for working class Americans, middle class Americans, and everyday Americans. People like Mariah Plant, who we heard from earlier today. She's a 29-year-old from a rural part of West Virginia, a state that Donald Trump won by 41 points. Mariah is a small business owner who gets her health care through the Affordable Care Act, and that's made affordable by the tax credits. If those tax credits expire, health care will be unaffordable for Mariah. She'll have to pay thousands of dollars more per year, and she's already dealing with the adverse implications of the Republican assault on the health care of the American people related to the largest cut to Medicaid in American history. Why is that? Because Mariah is the sole full-time caregiver for her older brother, Matt. And Matt is legally blind, and Matt is someone who is entirely nonverbal, and Matt is someone who requires full-time care. And because of Medicaid as it currently exists, Matt is able to be cared for at home in a loving environment. But now that's threatened by the Republican assault on Medicaid. You know what's also threatened for Mariah and Matt? The fact that their rural hospital may close because of the Republican assault on the health care of the American people. And then on top of that, Mariah may not even be able to go see a doctor herself because of the Republican refusal to extend the Affordable Care Act tax credits. That's why Democrats are in this fight. It's not a political struggle, it's personal for the American people. And just like we're telling Mariah's story, elevating it, as she did earlier today at our hearing, so courageously and authentically on behalf of everyone else in West Virginia and throughout the country, we're asking the American people to share their stories with all of us about the hardship that you're facing as a result of the Republican healthcare crisis and the need for something to be done about it right now. I want to give Stephen Horsford an opportunity to say anything, and Susan Delbene.
Thank you, Mr. Leader. I will just add, as a member of the Ways and Means Committee and Subcommittee on Healthcare, these enhanced premium tax credits, one, are supported by 78% of Americans, and they understand the impact of those tax credits to their ability to afford health care. And just like Republicans made a priority to pass massive tax breaks for the very wealthy, Democrats made it a priority to give tax relief to middle-class families so that they could afford health care. We're using the tax code to help middle-class families afford health care, not the ultra-rich get another tax break for a yacht or whatever else they're buying. This is a matter of life and death, and it's a matter of clear priority by the House Democratic Caucus, led by Leader Jeffries and Whip Clark and the rest of our leadership team. And it is personal, because not only are our constituents dealing with this issue, but members of Congress are dealing with these critical issues. And we will make sure that we continue to defend every person's right to health care. It is an economic imperative, and it's a human right.
You know what happens when more people have healthcare coverage? People are healthier and we save money. I think it's really important to think about the fact that when we have these tax credits in place, it actually saves us money. Cutting the tax credits means more and more people aren't going to have healthcare, more and more people going to the ER, more and more uncompensated care that others have to pick up the cost for, raising prices on everyone. Not just folks on the exchange, raising prices on everyone. Our healthcare system is challenged. We see more rural hospitals, more services in hospitals closed, more folks, more staff being let go. It's a spiral. So not only because of the incredible stories like Mariah that the leader was just talking about, but also from a fiscal standpoint, it's the right thing to do. It helps our communities, more people have coverage. It's more fiscally responsible, and yet Republicans are still on vacation and have no plan on how to continue going forward.
I just want to say, look, I sit on Energy and Commerce. I sit on the committee that does everything on healthcare. And I can tell you, hearing after hearing after hearing, we are not hearing Republicans come up with legislation or bills that's going to bring down the cost of their healthcare. On the contrary, everything that's being done is raising cost. So the party in power right now, the Republican Party, who controls what the hearings are not having hearings on how to lower the cost of healthcare or premiums. Look, we want to make sure healthcare is accessible to everybody, whether you're a Democrat, whether you're a Republican or an independent in rural America, in small towns, in cities like mine. This is about healthcare. This is about getting everybody access to healthcare. And I can tell you that we do not have those hearings. The party in charge has not expressed an interest in committee on having hearings on how to bring the cost down. So Democrats are fighting to do just that.